It's a health crisis that's been grabbing a lot of headlines in recent months, but it turns out Alberta's former chief addiction and mental health officer tried to sound the alarm about fentanyl 3 years ago. A document obtained by CBC News shows that in July of 2014, Michael True asked for a bigger role in battling opioid abuse. After the NDP was elected, True's office was disbanded, and the number of fatal fentanyl overdoses in Alberta continued to grow. This new info comes at a time when some are calling on the province to declare the opioid crisis a public health emergency in Alberta. The issue is raised in the legislature today with the Wildrose opposition citing CBC's story.
This government has no coordination of services, no action plan, and ministry officials can't even identify 3 priorities. How many Albertans have to die before you'll stop being part of the problem, declare a public health emergency, and table a comprehensive action plan to address it?
Albertans want to know that their government is responding to the overdose crisis as a top priority. We are. We've expanded access to the take-home naloxone kit program. We're expanding access to treatment such as opioid replacement therapies, and we are doing everything that we can to support the opening of supervised consumption services in our province.
My next guest is one voice in a chorus that is calling for a public health emergency to be declared here in Alberta. Dr. Hakique Virani is a public health and addiction specialist with the University of Alberta. He works on the front lines of the fentanyl crisis in both Edmonton and in our city, Calgary, as well, and he joins me via Skype, as you can see. So, Dr. Virani, what do you think of the fact that there were calls to increase the government response to this problem years ago and that those calls weren't acted on then?
Well, we know that it's true. I mean, Dr. True was one of those voices amongst, as you say, a chorus. I know myself had written to the Minister of Health in 2008 about a growing prescription opioid problem and a need to expand access to treatment. From 2009 to 2011, the Chief Public Health Officer, the Chief Medical Officer of Health, completed a report on the opioid crisis and called for public health leadership on that. I wrote to the minister in 2013 with concerns about, a very common sighting of bootleg fentanyl and increasing mortality from opioid use and a need for more treatment. The Coalition on Prescription Drug Misuse urged the government to prioritize access to treatment in 2014, 2015. So, and that's just a few of the folks that have been experts calling for an urgent response to this crisis. So there's a tendency to blame the government of the day, but I think this is more a manifestation of public health infrastructure that's failing to deal with an emerging health threat.
And you're calling for an urgent response in the form of a public health emergency being declared. What sort of difference would that make?
Well, Public Health Act legislation is in place for us to deal particularly with emergent threats to human health, where taking ordinary measures does not satisfy the public health need, and where you need extraordinary powers when those ordinary measures are not mitigating the risk to human health. And that's clearly the case here. Our numbers continue to increase, right? In Q1 of 2017, we saw 60% or some 60% more deaths than we saw in the same period last year. Thankfully, there wasn't. It seems like the numbers are about the same as they were in Q4 of 2016, but those numbers tend to be an underestimate until the medical examiner completes the review of all the fatal cases. So we're having about 2 people dying per day from opioid related poisoning, and that's going to require us to exercise specific powers and allocate specific resources to treat this as an urgent problem, which we've not done as yet.
What sort of powers are you talking about?
Yeah, so the allocation of resources is really important. We heard the Associate Minister say that there's been an increase in the availability of access to opioid addiction treatment. But really in the past 3 years, we've only seen an increase of about 2,300 people getting access to this treatment. We're talking about tens of thousands of people who may benefit from this treatment and prevent death from opioid overdose. We cannot, in our current setup, provide access to that number of people. So specific provisions of the Public Health Act would allow us to recruit physicians specifically to treat this problem, train them very quickly, and provide unfettered and on-demand access to treatment for anybody who could possibly benefit from it. We're in that kind of an urgent problem where if somebody has an aha moment in the middle of the night and says, I really don't want to die tomorrow if I access bootleg fentanyl, we'd like to be there for them to provide treatment, and we're not.
And I know you and your colleagues have grown so frustrated. In fact, you've taken your own initiative and set up a treatment center here in Calgary, in Edmonton as well. You heard the Associate Minister off the top talk about the move towards safe consumption sites. Now, this is something that the federal government, Ottawa, recently opened the door to. And our Chief of Police here in Calgary has been talking about the need for this as well. You have your ear to the ground in this city. Are we any closer to this happening anytime soon?
Yeah, I would say that it's encouraging to hear people who work in the city being extremely motivated to participate in opening such a site very quickly. The sooner that it happens, the better. And I think that important people who will have a part in executing on the initiation of harm reduction services like supervised drug consumption sites are all motivated in the same direction. So that's good. Like I said, that can't happen soon enough. Every day that passes, as I said, we're seeing a couple of people dying from opioid overdose. And we know that that can be prevented by harm reduction interventions like supervised consumption.
That said, BC has a site. It has also declared a state of emergency, and their death toll continues to rise. What else needs to be done?
Yeah, it's a good point. I mean, declaring a public health emergency doesn't declare a solution to the public health emergency, right? You and I can declare that supper is prepared, but that doesn't mean we don't have any work to do. You still have to do the work of exercising those powers. I think that BC has done some really important things that have probably, as hard as it is to believe, have probably reduced the increase in the number of deaths, even though we still see those numbers climbing. We need to see the same sort of bold moves towards more overdose prevention services like supervised injection sites, more offering of options for treatment, including for entrenched substance users who could benefit from supervised injectable opioid replacement therapies, and on-demand treatment with other evidence-based therapies like medications like buprenorphine or Suboxone and methadone. And we've just not seen that kind of bold move here in Alberta. It's very concerning and increasingly concerning because we know that the toxicity of the illicit opioid supply is growing. We've talked before about that drug carfentanil and other types of bootleg fentanyls that are more likely to result in mortality even than fentanyl. And we're seeing more of that, saw more of it in Q1 of 2017 than we saw through most of the year 2016.
Dr. Virani, thank you for this.
You're welcome, Rob.
The autopsies have been